It's Wednesday, April 15th, and I'm Tricia Gardner, Public Health Officer for the City of Great Falls and Cascade County. Some community members have reached out for clarification about face coverings. Questions they've asked include, should we still be wearing cloth face coverings even though we don't have that many cases in Cascade County? What about N95 masks? How do I know my face covering is effective? How do I take it on and off correctly? And how do I take care of it? First, the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as grocery stores and pharmacies, especially in areas of significant community-based transmission. At this time, community-based transmission has not been identified in Cascade County, but this is still an excellent habit to practice. Face coverings are important because COVID-19 can be shed in the days before an individual becomes symptomatic. A cloth face covering is not intended to protect the person wearing it, but it may prevent the spread of virus from that person to others. This would be especially important if someone is infected but does not have symptoms. Keep in mind, though, that wearing a face covering is not a replacement for other social distancing measures. It is still critical to wash your hands regularly, maintain 6 feet of distance between you and other people who aren't in your household, and avoid touching your eyes, nose, and mouth. If you are coughing or sneezing, you should wear a mask when around others and isolate at home except to seek medical care. Once again, if you have symptoms, call ahead before going to a medical facility so that they can take appropriate precautions to prevent the spread of illness. N95 and surgical masks are in short supply and need to be reserved for healthcare workers and first responders. First responders and healthcare workers who have to be in close proximity to many potentially infectious people need masks that can prevent exposure to airborne virus particles. It is critical that we reserve N95 and surgical masks for these people who are risking their health to protect the health of others. Cloth face coverings for the public should cover both the nose and mouth, fit snugly but comfortably against the sides of the face, be secured with ties or ear loops, include multiple layers of fabric, allow for breathing without restriction, be able to be washed and machine dried without damage or change to shape. Don't put cloth face coverings on children under the age of 2, anyone who's having trouble breathing, anyone unconscious, or anyone who could not remove the mask without assistance. The CDC has instructions on how to make sewn cloth face coverings along with no-sew options. For more information, click on the link in this Facebook post. Wash your hands before putting on your face covering, or use sanitizer if you're unable to wash your hands. Don't touch your mask while you're using it. And finally, when you're removing your face covering, be careful taking it off so you don't touch your eyes, nose, or mouth. Wash your hands immediately after removing it. You can safely sterilize your cloth face covering by routinely washing and machine drying it. This should be done routinely depending on how much you are using it. After it's washed, if you want to be particularly careful, you can place it in a clean Ziploc bag. As usual, we'll update our Facebook page later this evening with the number of cases in Cascade County. Please call us with any concerns or questions at 406-454-6950 or email CCHD at health@cascadecountymt.gov. Stay home and stay safe.